Erica, you have the link? Okay. I think we have, yes, you can record screen, Nam. Okay, well, good afternoon, everybody. My name's Claudia Briggs. I'm with the Communications Department with the California Teachers Association. We appreciate you all being here today. We have some very important news and information that our research firm has found about the sentiment of voters and parents as schools reopen and move in different tiers. And so I just want to talk about a couple housekeeping things. If you have any questions, please direct those questions to me, Claudia Briggs, in the chat, just to not overwhelm and distract as the conversation's going on. So if you can just send those directly in the chat to me, Claudia Briggs, I will make sure that those get addressed later on during the Q&A section. We are going to do things a little differently. After Dr. Robert Harrison speaks, we're going to go directly to questions for him. So if you have questions of him, please do put those in the chat. And then let's see, we ask everybody to stay on mute, and then we'll talk about questions as we go. Okay, so without further ado, again, thank you. This is Claudia Briggs with the California Teachers Association for our news conference, talking about polling results, parents and voters' concerns for health and safety of students and educators. And, you know, they support opening schools only when it's safe. Today, speaking to us will be Jeff Guerin, who's with Hart Research Group, and Dr. Robert Harrison, who is an expert in safely and workplace safety with the University of California, San Francisco, CTA President E. Toby Boyd, and then we also have Ken Johnson, who is with a teacher in Manteca. So thank you again for joining us, and we'll go ahead and get started with Jeff. Jeff, take it away. Thank you.
Great. Thanks, everybody. I am going to share with you the results of a survey that we recently conducted on behalf of the California Teachers Association. We interviewed a total of 1,296 registered voters across the state. The sample was constructed in a way that allows us to look at a representative cross-section of all voters across California, and then also among parents who send their children to public school. They represent 24% of the total weighted sample. You can see that in terms of the racial and ethnic composition of these two universes, the parent, as is the case in actuality, the parent sample is more diverse in terms of a race of where 43% are non-Hispanic whites, 42% are Hispanic, 10% African American, 10% Asian, and 4% African American. Just as background to all of this, we, before we asked specifically about schools, we asked voters and parents about their perceptions of the coronavirus in California today. You can see 8 out of 10 voters statewide say that coronavirus is still a serious problem in the state. Only 21% of voters say that it's now pretty well under control. We also asked people about the state of the spread of coronavirus in their own local area. And there again, while it's lower than for the state as a whole, 63% say in their own local area, coronavirus is still a serious problem. And a majority of Californians, despite everything that the state has already gone through, believe that the worst in terms of the spread of the virus is still ahead of the state, not behind it. There's as is true in all the national polling that we've conducted on this topic and polling in other states, there's a kind of a partisan dimension to what voters think and believe about this. You can see here that Democratic voters and nonpartisan voters, people who are unaffiliated with either party, are more likely to think that the worst is still ahead, while Republican voters tend to think that the worst is now behind us. We did polling for the CTA in the spring on this topic, and we asked then and asked again now about the degree to which voters and parents worry about someone in their family becoming infected with coronavirus, getting sick with coronavirus. And we have not really found much drop in concern over this. You can see 7 out of 10 voters and 3/4 of parents say that they worry a lot or worry some that they or someone in their immediate family will get sick with coronavirus. So that concern still persists. And when we ask voters and parents what worries them more, are they more worried about reopening the economy too quickly in a way that will cause more people to get sick and cause another major wave of infections, or waiting too long to reopen the economy, resulting in more businesses failing, higher unemployment, and greater loss of income? You can see that the greater fear and worry for both voters and parents now, by a substantial margin, is that moving too quickly in a way that would cause a greater spread of the virus. And in fact, when we ask people in a separate question, well, when is California going to get ready to get back to normal, whatever they considered normal to be? The large majority of voters say that's not going to happen until next year. We asked about the decision to close schools at the end of last school year, starting in March, and there's overwhelming approval for that decision. 84% of all voters, 81% of parents, with about 3/5 of each group strongly approving of the decision to close schools last spring for in-school instruction. Although, the reality is many parents say that having their kids learn from home was kind of a mixed bag. About half said it worked very or fairly well for them and their kids, but others had a less positive response, and 2 out of 10 say it didn't really work well at all for them. There's a kind of a college attainment gap in these results. If people who are college graduates were a little bit more likely than non-college graduates to say that it worked well for them. And then we asked parents about how much of a problem was it for them personally to have their children at home in terms of interfering with their work and other things and just the stress that it caused. And 42% say it wasn't a problem for them, but a good number of parents said at some level that there was a problem. Now turning to schools, before we got into any structured question or structured response, we just said to our respondents, what's on your mind when you consider whether, how, and when schools should provide in-school instruction? What considerations should be most important in making these decisions? What do they think should happen? And you can see the responses here almost entirely speak to this kind of really persistent and consistent sense of caution and emphasis on safety that people have. The most common answers are that virtual learning needs to continue online. Schools shouldn't be open until in-person instruction, until we have a vaccine, not until it's safe. Some other respondents are talking about what a safe reopening of in-school instruction would look like. But we're not getting a lot of people who are volunteering that it's important for kids to go back to school right away. So the top of mind response is very much, oriented to safety, keeping students safe, keeping staff safe, keeping their families safe. When we give respondents 3 different options for how schools might be operating right now, there are very few either voters or parents, only 1 in 10, who say that schools should be fully in person. So there's really not that's a distinctly minority view among our respondents. There are a good number of both parents and voters who would like some kind of in-school participation or a hybrid model where there's some in-person learning and some remote learning. And then, but still, half of all respondents, both in the parent group and the voter group, say for the time being, it should be entirely remote. So that in the support for remote only learning is in the kind of the most dense urban places, LA County and the Bay Area. And there are parents, 40% of all parents would like to have some in-person experience for their kids, mainly through a hybrid experience in districts where learning is entirely remote. We asked separately, when should schools open statewide for in-person instruction? And we get a really surprising number, 4 out of 10, who are saying schools shouldn't open at all until there is a vaccine. Otherwise, people say it shouldn't happen until there's a low infection rate. Again, we're getting a very small number of respondents who say that schools should be open now. When we explain that there's a policy in the state that only allows school reopening for in-person instruction, when a low infection rate has been achieved locally, 63% of voters and 65% of parents approve of that. And when I mentioned earlier in the open-ended response, the orientation is entirely toward safety, that's the filter through which voters and parents are thinking about this question. That's borne out in this really important part of the survey, where we gave our respondents 4 different factors that they might consider in making decisions about how, whether, and when schools reopen for in-person instruction, and said, well, of these 4 things, which should be the most important? Then we asked which should be the second most important. But you can see by far what people are saying is the most important is protecting the health of students, staff, and their families. And to the extent that there's a second choice, it is also safety related, which is avoiding additional spread of coronavirus in the community. It's not to say that parents don't care about the academic situation of their children and making sure that their academic and social needs are met, and they're not insensitive to the needs of parents. But in a hierarchy of priorities, the priority clearly is safety first. It's really safety second, and it's very much the prism through which voters and parents want these decisions being made. We asked parents about their comfort level with sending their children back to school right now. Only 38% said they definitely or probably would feel comfortable sending their kids back to school now. 62% said they would not feel comfortable sending their kids back to school now, including 39% who say they would definitely not feel comfortable. That's closely tied to a feeling that of a lack of confidence that schools could reopen safely right now with a low risk of infection. You can see 65% said they're not really confident that would occur. And interestingly, they're not very optimistic of kind of where things are headed in that direction. When we asked them to think about the situation in November, people are even less confident that schools are going to be safe then. I think because they're thinking about the possibility of another wave of infections. And when we ask again, kind of in this kind of hierarchy of worries and concerns, which is the bigger concern for them, their children becoming infected with coronavirus by going back to school, or their children falling behind academically with no in-person instruction. By 69 to 24, the bigger worry for parents is about their children becoming infected with coronavirus. And I should say, we asked kind of very specific questions about that. People worry about that. They also worry in our survey about children, students bringing the coronavirus home and infecting other members of their family. So then when we turn to the question of what does a safe school reopening look like, again, we went at this before any prompted questions in an open-ended way, and we let respondents tell us what they think should happen. And they're telling us what the public health experts are telling us, that everybody needs to wear a mask, there needs to be protective equipment for students, teachers, and staff, that there needs to be social distancing in the schools. They talk about other things in terms of disinfectants and sanitizers, and then there are a bunch of people whose instinct is you just need to keep schools closed until there is a vaccine. After we explain the current policy for schools, keeping schools closed until a local infection rate had reached a low level, we said, are you for or against having a waiver for that policy just for elementary schools? That creates some division of opinion among parents of elementary school students. By 55 to 45, they say that they would be supportive of waivers in those cases. But again, I think, dependent on safety conditions being met. And where there's much more support for a waiver is in the case of some very small group instruction for special needs children. And again, parents of special needs children are particularly supportive of that, but parents in general are as well. We asked voters and parents about whether Governor Newsom and their local school district are moving too quickly or moving too slowly to reopen schools. A plurality of respondents say that both are doing it at the right pace. And to the extent that people are dissatisfied, they are equally likely to say it's being too slow and too fast. So there's, it's not that the folks who are unhappy are all unhappy in the same direction. They really split pretty evenly here, but by and large, the center of gravity is people being satisfied. We asked in terms of, in order to for schools to reopen, what are the things that should happen? We gave people a list of different items here and asked them about whether they consider them essential. And by essential, we were clear that schools shouldn't open unless this is happening. And you can see here on a whole host of things, we have majorities of parents saying that not only are they important, but they are essential. That is, schools should not open unless these things happen, including deep daily cleaning, 8 out of 10, requiring face masks, 8 out of 10. We've got several items in the 70s there. And there is a broad recognition that in order to achieve these things, schools are going to need to have more funding. Only 19% of voters and 21% of parents say that schools have the funding they need to deal with the impacts of coronavirus. And we get significant shares of the electorate and the parent body who say that not only do schools need more funding, but they need a lot more funding. And this crosses party lines. 65% of Republican voters, the most fiscally conservative, say, in this case, schools need more funding in order to deal with the impacts of the coronavirus. In terms of who's trusted on these questions, it's public health experts, Dr. Fauci, the California Department of Public Health, and teachers also carry a very high level of trust relative to others in terms of who's weighing in on decisions about whether, how, and when schools should reopen. President Trump and Betsy DeVos are not trusted on these questions at all. And you can see that teachers are more trusted than the local Board of Education on these questions. We asked people about the position of the California Teachers Association, which we described as their firm stand, that in-school instruction should only be permitted if the district has clear plans for testing, contact tracing of students and staff. There is widespread approval of that among both voters and parents of the CTA taking that position and standing up for that position. And majorities of both voters and parents not only approve, but strongly approve. So let me turn it back, and I'll be happy to answer your questions after the others have had a chance to present.
Thank you, Jeff. And now we go to Dr. Bob, who will speak to us for about 3 to 4 minutes. To take it away, please, Dr.
Thank you. My name is Bob Harrison. Very happy to join you. I'm a clinical professor at the University of California, San Francisco. I specialize in, excuse me, let me turn that off. I specialize in occupational medicine. That's the treatment, the study, the prevention of workplace injuries and diseases. And I'm sure everyone's aware that COVID-19 probably is one of the largest, if not the largest, occupational disease challenge of certainly my lifetime and perhaps in the last 100 years, with thousands of outbreaks around the country in workplaces, many tens of thousands of workers infected, many die from COVID-19 infection. So all workplaces, to put this in context, are facing the challenge of protecting essential frontline workers. Teachers and staff in schools are one of those, most certainly. Schools are unique because they're the intersection of staff and teachers, are essential workers, with our students, our children, our family members. And so it is clear from both a workplace and a community perspective that keeping teachers and staff safe from COVID-19 in schools will also help keep our students and their families safe as well. So there's very clearly an intersection between those two groups. When we think over the next several months or year about how and when we reopen our schools, we have to be prepared that there will be infections in schools among both students, staff, and teachers. There will be most likely outbreaks. So we have to be prepared to both protect and respond immediately with contact tracing, testing, and notification. We know that from experiences worldwide and from many other states around the country that have seen infections and outbreaks and school closures. So it's essential that school employers and teachers need to work together with families and local public health departments to plan carefully for school reopening. The layers of prevention for teachers and staff will help prevent the spread of COVID within the schools. And that will be from both teachers and staff to students, and from students to teachers and staff. And by doing so, it will help control the spread of COVID within the larger community. So teachers and staff, in my view, have to have strong layers of prevention and protection to reduce the risk of workplace COVID-19 infection. These measures should include reducing the number of contacts, social distancing, face coverings, adequate ventilation, hand washing and surface cleaning, symptom screening, and testing for outbreaks, and to monitor infections moving forward. So all school employers should have programs to accommodate students and teachers who are also at higher risk of severe illness, or who have family members who are also at high risk of illness. So let me just wrap up and take your questions by concluding that as an occupational medicine physician, someone who's been treating workers who've had COVID infection and who I'm now seeing have what are been termed the long COVID, which is a term for persistent symptoms with fatigue and some neurological and cardiac and pulmonary complications. This is a virus that needs to be taken really seriously. And that to prevent occupational infections, that all of those layers that I mentioned for teachers and staff are going to be protective of them and our children and our families are essential as we move forward.
Well, thank you, Dr. Bob. We do have a few questions here. Again, a reminder, if you'd like to ask Dr. Robert Harrison a question, please send me a message directly. So we have a couple questions here from Howard Bloom with the Los Angeles Times. Do you support the state's tiered reopening system as it's currently structured? And how would you change what the state is doing now to evaluate when schools should be able to reopen?
Claudia, was that a question for me? Okay,
Yes.
yeah. So the state's tiered reopening plan is triggered by community COVID rates, by the positivity rate and other measures in the local communities. And it's then color coded to different tiers for a gradual stage reopening of schools. In a general sense, yes. Reopening schools, because local communities transmit within families and then those children enter our schools and then can transmit to teachers and staff. Those staff and teachers may live in the local communities. So it's really quite clear that we can safely reopen schools when we're also controlling COVID transmission in the larger community. So as we drive down rates and keep them low in the larger community, then we can reopen schools in a staged manner, provided that the layers of protection that I mentioned are also present in schools.
Okay. Do we have any other questions for Dr. Bob? Okay, well, thank you. We'll go ahead and proceed. Now we have E. Toby Boyd, kindergarten teacher and president of CTA. Go ahead, Toby.
I guess I have to put my mic on in order to make that make sense. You know, you could probably read lips, but yeah, I'll say it again. Hi, folks. I'm E. Toby Boyd, president of the California Teacher Association, and more importantly, a kindergarten educator. And I want to thank Jeff and the Hart Research and Dr. Harrison for sharing their important information today. As you folks can see, we've been asking our electeds to do just that, to make sure that we reopen schools when it's safe. It makes only common sense that we look at the science and we take care of our students and our teachers before we open schools. We can't do it unless it's safe. And that has been what we've been saying. And the research has showed us that we have been on the right track. Our teachers want to be in front of the students, but we have to do it in a manner that we look at safety. Many of the districts throughout the state have already gone through problems when they reopen too quickly, and we have to be concerned with that. We have several counties that have done so. We can go from Modesto to Oakland to San Bernardino to Manteca, areas that we've seen opening happening too quickly and then they have to close. We have colleges and universities that have had significant outbreaks, and they've gone through this yo-yo effect, and it doesn't do anything to help our students. And as a matter of fact, it actually hurts them because of the uncertainties. COVID-19 is a community problem. You know, the voters and the parents have echoed that in their concerns in the research that you've just heard about. Coming back to prolonged indoor activities cannot occur unless we have proper ventilation. Our schools are antiquated. A lot of them are old, and they don't have the necessary filtration with the ventilation. They don't have the space for the students to go. They don't have the health people in place in order to make sure they have the tracing to take place. So when you think about schools, you have to think about our children, the ones that are in our classrooms. They may go home to a multi-generational household. They may go to a household that has a person that has an impaired immunity system. We have to make sure that we look at the totality of everything in order to make sure that we continue to consider their safety. So that's why it's important that the layers that Dr. Harrison mentioned are in place for our students to make sure that everything is there in a comprehensive type manner to prevent the spread of the infection. You know, ventilation is one of the main things the doctor spoke about. The protective gear, equipment that's needed, that our teachers need to have. You know, it's stated that everyone above the 2nd grade should wear a face mask. That's important. But how does that happen if there's no funding? And, you know, we have to make sure we think about that. We have a leaflet that has a lot of information. You can find this on our cta.org website that will give you the information that Dr. Harrison spoke about and the layers in which he said that's needed in order to bring school back in a manner that's safe. You know, we have to talk about testing for our students. It has to be one that's rapid. We cannot afford to have tests occur and then wait 2 to 3 weeks after the fact, because by then the infection could be spread throughout the school, and then you have to have those schools closed. We need to make sure it's rapid, that the turnaround is quick, and that our students and our staff and the educators are actually being tested on a regular cycle in order to prevent the spread of the COVID-19. And we have to have individuals in the school that know what they're doing. Those are the health experts that each of the counties need to make sure there's a plan that's in place for the districts. When they say, oh, we're ready for this, they need to make sure that they are truly ready and that the counties understand the steps that are going to be taken in order to assure that. And then once an outbreak occurs, we have to have contact tracing, folks. We have to understand who has been in contact with the person. Remember, it's 15 minutes in a unventilated area that's not well. And our school sites are not that right now, at least the majority of them are. So we need to be able to go back and trace those people to ensure that their families are going to continue to stay safe and that the other students are in our schools are also going to be safe. The last thing we want to do is to have a student with the virus take it home to that home, and then that child has on their mind the fact that they caused something to happen to their family. That would be unforgivable. You know, again, looking at what the experts are saying, the departments of health, Cal-OSHA, that is going to be important in order as we navigate these waters from county to county to ensure the safety of our students. When these occur, we need to make sure that the educators and the parents are involved in the conversations. They need to know exactly what's going to be in place in order to ensure that they are confident of the things that are happening. So when districts and administrations are setting up these goals and setting up these parameters, it only will truly benefit the community if you have educators, if you have parents involved in that process. But it doesn't work, and it's not going to work unless we have funding. And that's the number one thing that parents and the voters were concerned about. They said we don't have enough funding, but we can get there. Most of you folks know that today is October 15th. This is the day that the trigger cuts are supposed to take place because of the budget. We are facing a $12.5 billion deficit next year. That's insurmountable, and it's nothing like I have ever seen in my 26 years of teaching. It's bigger than what happened in 2008. So we need to make sure that we have some type of funding rescue. You know, the federal government hasn't done it so far. So we need to make sure that if we want to reopen our schools and we are going to do it in a safe manner, it has to be funded. And we are concerned about that. One of the ways that we can actually help this year, because the impact is going to be felt throughout the state, not one district, one county is going to be spared from the cuts. But we can help buffer that cut. And that is if we get behind and vote for Prop 15, the Schools Communities First Initiative. It's going to bring and reclaim $12 billion into our communities and our schools. And folks, we really need that in order to help our schools, especially at this time while we're fighting this pandemic. So again, I'd like to thank Jeff, Dr. Harrison, the Hart Research, because they showed what our parents, our voters are feeling, what they are worried about, and we couldn't have done it without them. So please remember, if you haven't already done so, please vote yes on Prop 15 too, because it would help mitigate all the things that we need to do in order to return to school safely. So Claudia, I'll turn it back to you, and thank you very much.
Thank you, Toby. And now we'd like to hear from Manteca educator and president, Ken Johnson. Ken?
Good afternoon. My name is Ken Johnson. I'm a junior high school social studies teacher, and I've taught for 38 years. From the beginning of this pandemic, the safety and health of our students, staff, and community have always been a priority, as it should be. Back in August, as we were negotiating with our district on distance learning, they refused to allow educators to be part of the conversation that affects the health and safety of everyone at the school sites. It got so contentious to the point that we had to declare impasse. Without a comprehensive safety plan, teachers and students cannot return to teach and learn in unsafe conditions. When we went back to school in August, we had 4 teachers at one school infected with COVID that very first week. We still don't have HVAC units to properly ventilate classrooms. We don't have appropriate PPE, and we don't have any procedure for contact tracing, some of the basic elements needed for a healthy and safe return to school. The district, however, has decided to spend $1 million on new computers for every teacher, which frankly is not needed. That money could have been better spent by upgrading our heating and air conditioning units to properly ventilate the classrooms. You know, if you're not supposed to have family get-togethers at the holidays, then why is it safe to have mass gatherings of students in classrooms with poor ventilation? Think about this. The district's procedure for PPE was to give every educator a $50 gift card to buy their own PPE supplies. I don't even have to explain what's wrong with that. Being expected to protect our students from a deadly virus is something we are not, I'm not, and frankly, anyone who is not an expert, not trained to do. If we want to prepare schools to reopen during this pandemic, we need additional funding, so the choice doesn't have to be between safety and technology. We could have it all, and our students deserve that protection and investment. Educators are still forced to teach in these unsafe conditions, and I'm deeply worried for the students returning to school sites in November for our hybrid learning model. They are sacrificial lambs being led to the slaughter. We already saw what happened when you opened too quickly and without adequate safety measures. 4 employees from the same school testing positive. Imagine the risks involved when bringing everyone back. Classrooms should be a safe place, rather than a wave of fear taking over the lives of students and educators. Educators have never stopped teaching and students have never stopped learning. Until proper safety measures are fully implemented, virtual teaching and learning from our homes is no different than being in a classroom. Educators are not scientists, so expecting school districts to know the science and decide when to bring students back is not safe. That is simply not our job. As educators, we want to be back in the classroom with our students, but there is too much at risk to ignore science, facts, and safety. I dearly miss my students, even if they are hormonally challenged. COVID-19 is not going away anytime soon, and the sooner we realize that, I hope adequate safety measures are implemented to protect everyone. Thank you.
Okay, well, thank you very much, Ken. Again, I just want to remind you, we do have a few questions in the queue, so I will go ahead and pose those now. But just a reminder to send me any questions you may have of our speakers today. All right, and we begin with, actually a couple of reporters asked this, so if we can, Jeff, have you talk about the methodology, the margin of error for each of the voters and the subgroup of parents, and how is the poll conducted, i.e., online, phone, and how were the participants selected?
The survey was conducted online with a panel of people who, with the quotas set so that we match what we know of the demographics and political leanings of the universe from the voter file, so that we go through a very elaborate and detailed screening procedure to make sure that we're including the voters in a way that makes them representative of either the parent universe or the larger universe of voters. We did a total of 1,298 interviews, but that included an oversample of parents. The effective sample size for the voter poll is 1,000, with a margin of error of plus or minus 3%. With the combination of the parents from the main sample plus the over sample of public school parents, there's a margin of error of plus or minus 4.5%.
Okay, and then there's a follow-up, and you may have touched on that as I was multitasking here. In the release, we say the sample was structured to analyze a representative cross-section. Diana Lambert from EdSource would like you to elaborate on that if possible, please.
So we are able to know from the voter file what the universe of California voters looks like at a very detailed level in terms of age, their party registration, their race or ethnicity, and that not only on a statewide level, but within different regions of the state. So we screen for and accept respondents into the sample in a way that means that at a deep level, our sample of respondents matches what we know to be true of these universes by all sorts of demographic and political factors. And we do a lot of polling in California by a variety of methodologies, including by phone. And so the work that we do online matches the very closely to what we find if we're doing a parallel phone survey, for example.
Okay, thank you. And we have a reporter who's asking who paid for the poll. This is a poll paid for by CTA. It's educators wanting to know where other voters and parents stand in terms of reopening, since there are a lot of concerns, and as you can see, majority of individuals are concerned. They've talked about it. They've expressed and shared those concerns with members across the state, with leadership. This was a way to find out exactly where people stand. Any other questions from anybody else? Okay, Toby, this one's for you. Okay, this is John Woolfolk. He would like to know, he says the state says that outbreaks so far with class reopening in some areas have been minimal, and he would like comment on that. And then also, some parents say, my husband works at Safeway, but he's essential, so he goes. Why should school teachers be different? And since it's posed to you, I'll go ahead and let you do it
Okay.
and answer the question. Thank you.
Well, I'll answer the latter one first. Educators going to the classroom, I find is different than, say, Safeway. Yes, we are both essential. Yes, we both want to be, educators want to be in front of their classrooms. The difference is that you have sometimes 33 to 40, sometimes 50 students in a classroom. And that in itself does not make it conducive for, the ventilation, for the spread. Safeway might be different because you may not come in contact with a person. You can do the social distancing. You don't have that initial contact and the capability of having the infection spread. So the comparison, yes, they're both essential. Do our educators want to be in front of the classroom? I would say yes. Is it different? Yes, because we have a smaller space with a larger number of students that could cause and pose a greater chance of infection. Now, as to the schools, just with the reporting of the COVID, and then that might be part of it. I can't say that all the schools are reporting the actual numbers when they occur. I know just a couple of days ago in Modesto at Gregorio High School, they just closed because they had an outbreak there. We can go back to in Sonoma County, there were closures then. So I think that one incident of infectious transmission of COVID-19 is too much, because if one of them is fatal and kills someone, then again, it should not occur if we can prevent it. And we can prevent it by making sure we have the layers of precautionary measures in place so that our students can go back and be minded and be reassured that they are in a safe environment.
Yeah, and also the schools have the viable option of remote learning. A Safeway cashier cannot, work remotely. I'll just add that. Okay, we have another question. This is from Jill Tucker, the San Francisco Chronicle. Toby, this question's for you. If a school meets county requirements for reopening, which includes the PPE, ventilation, hand washing, etc., and the county signs off, do you consider that safe to return for teachers? I just, when you say etc., Jill, I'm not sure if you're referring to all of the items on the list that CTA members have identified as the assurances that must be in place in order for schools to reopen, and also if they are, you know, part of what was outlined by Dr. Bob. But I'll go ahead and just step aside and have Toby answer that question.
Thank you for the question. CTA's stance has always been that as soon as it is safe for our members, the educators, and our students to go back into the classroom, we are willing to do so. But we have to make sure that all the precautionary measures are in place, that there's going to be the contact tracing and also the testing. We have to make sure that there is a accountability and there's a recognition of when there is an outbreak, it's going to be reported. And there has to be mitigating things in order to ensure that they are safe. So if all of those items are in place, if UESF, those are the educators in San Francisco, have gone through the process and have agreed to knowing that it's going to be safe, they'll be back in front of the classroom. That's what they want to be. But until they can be guaranteed that it is safe, I can't tell my members to step back in there when there's a possibility of the COVID-19 virus infecting them, nor their families, nor any of the other students' families.
Okay. Just doing one more quick scan to see if there are any other questions. Okay. I know we have a couple follow-up that, you know, we will handle separately. So, okay. Follow-up from Ms. Tucker with the Chronicle. There's no guarantee that anything is ever safe. So what does that mean?
That's true. We cannot guarantee 100% safety, but we can guarantee that we have in place the items that we've asked for them to happen. And so as long as we can, to the best of our ability, guarantee, and I say to the best of our ability, that the schools are going to be safe, that's when they should be opened. Nothing's 100%, and I agree with you there. But we can guarantee, like Dr. Harrison stated, here are some things that can go into place. Is there a possibility that something can happen even within that environment? Yes. But we'll have a handle on it that if it does occur, we'll be able to test, trace, and make sure it doesn't get any further than what it is, and we can stop the spread of it.
Thank you, Toby. And just before we wrap, Dr. Bob, I know you're still on. Do you want to try to just briefly address that question? If you can still hear me, if you're still on. No guarantee that anything is ever safe. So what does that mean? Okay, well, I know he had class. So thank you, Toby, for answering that. And again, just wanted to thank you all for your participation, for being here today. Obviously, a very important topic that is weighing heavily on the minds of parents and educators and voters and the community at large. We will be making this recording available on our Facebook page later today. We will upload to our YouTube channel and also post on our website. So you can have that. We posted the news release in the chat along with links to all the different components that were referred to. If you need anything, if you have any follow-up, just please email myself or Erica, or me or Erica, and we'd be happy to help you there. Again, thank you so much. And we hope you all stay safe and have a great day. This concludes our news conference.